Donate to the Power of Hope Fund for Katrina Disaster Relief. Join Entergy as we help disaster victims rebuild their lives. Because the power of Katrina is no match for the power of hope.
Good evening and welcome to Public Square. I'm Beth Courtney.
And I'm Craig Freeman. Tonight, we look at the health effects of Hurricanes Katrina and Rita.
Well, it's been almost 2 months since these killer storms devastated southern Louisiana. Recovery efforts continue, but the state is still feeling the after effects of the costliest natural disaster ever to hit the United States. Some of the highest costs cannot be measured in dollars.
Nearly 1,000 Louisianans died as a result of the storms. Thousands of others suffered because they couldn't get access to their medications, dialysis, or other medical treatment. But some worry that the deaths and acute care problems caused by Katrina and Rita may be the first faint signs of a new storm on the horizon, a health care crisis of hurricane strength.
Well, in thinking about the health after effects of our recent storms, it's easy to get caught up in the obvious. Contaminated drinking water, toxic mold, infectious diseases. But many effects may not be physical in nature. Mental health problems for evacuees and caregivers alike loom as a healthcare concern. In some cases, symptoms may not appear for months. On a longer time scale, damage to the state's medical training facilities may affect healthcare delivery in Louisiana for decades. New Orleans evacuee Star Mason is receiving a tetanus shot before returning home. But Mason has other health issues on her mind.
What concerns me mostly is the mold. But I think when we all go back, we need to wear gloves. You need to wear a mask, I've heard, too. And hip boots. So that might be our next stop.
While house mold may cause minor respiratory irritation to some returning residents, a bigger concern is actually injuries during cleanup, according to state epidemiologist Dr. Raoul Retard.
You go back home, you are going to start removing things, trees, you are going to start using maybe a chainsaw, you are going to start using ladders, going on the roof, doing all kinds of things, lifting things up. So you end up doing all kinds of things you didn't do before.
Since Katrina, there have already been 50 carbon monoxide deaths caused by people improperly using portable generators. For evacuees still living away from home, infectious diseases are the main health concern. Our Lady of the Lake Hospital in Baton Rouge has been seeing an additional 80 inpatients per day since the storm. This added strain on the city's healthcare system has hospital CEO Robert Davich concerned about the flu season.
With all these people living in shelters or congregated in homes or in private homes, it would be the perfect incubator and setting for transmission of a serious flu season. This could be the third big storm to hit Baton Rouge in Louisiana.
I don't want to get caught in the water.
Hurricane Katrina has added to the mental stress of both children and adults. 2 members of the New Orleans Police Department took their own lives in the days immediately following the storm. Capital Area Human Services District has seen a 40% increase of mental health patients in its 7-parish service area. According to the district's medical director, Dr. David Post, this may only be the beginning.
As we track this out over the next several months, I think that the symptoms will increase, the strain and stress of individuals who find themselves, even though well-intended, in these kind of trailer cities that are coming up, perhaps increased substance use or depression and anxiety. The natural course would be to see some escalation in those things.
The district's executive director, Jan Kosofsky, is concerned about staffing to meet the increased patient demand.
A lot of what we've been able to do has been because we've had people coming in, really fine physicians, social workers, psychologists, addiction specialists, to come in and help us. At this point, most of those people have left, and I am very concerned about not only us being able to sustain what we've been able to provide over the past, really now almost 6 weeks, but with the increasing need.
The shortage of healthcare providers is an even greater concern in the New Orleans area, which saw nearly 4,500 doctors displaced after Katrina. Already, some have set up practice out of state rather than wait to return, a situation which worries East Jefferson Hospital's CEO, Dr. Mark Peters.
If we lose physicians from our community, the efforts, the costs to replace them, to recruit replacements, will be very, very high, much higher than any dollars that we put forth to help retain them by helping them maintain their practices.
East Jefferson is among one of 3 private hospitals in New Orleans that continue to operate through the hurricane. Although bed occupancy initially dropped almost 50%, it is gradually increasing. But the hospital is losing hundreds of thousands of dollars a day, according to Peters, who recently testified before Congress seeking assistance. East Jefferson not only provides health care, but combined with West Jefferson and Ochsner hospitals, employs over 10,000 people in the New Orleans area. The public hospitals in New Orleans also took a big hit from Katrina. The 2 medical centers of Louisiana structures, Charity and University, both suffered severe damage and may be torn down and rebuilt. The temporary loss of Charity, the state's major training hospital, may also contribute to Louisiana's physician shortage, according to Dr. Fred Lopez with LSU School of Medicine.
Already we're importing around 250 physicians to Louisiana to provide care for Louisiana citizens. If in fact you now remove the medical center of Louisiana, it's going to have a very dramatic impact on health care delivery in this state.
What part can the state government play? Governor Blanco has called for a special session of the legislature to deal with legal and regulatory issues created by Katrina and Rita. Representative Michael Jackson sits on the House Health and Welfare Committee.
It's very important that in times where there are limited dollars that we put together new models for delivery of care. Hospitals can talk to health centers and public health units. They're all receiving dollars from the state and in some cases the federal government to deliver primary health care. There ought to be a mechanism or a model that can be put in place to deliver that care at a more efficient rate.
While the future of the state's healthcare system post-Katrina seems unclear, Louisiana Hospital Association CEO John Medicino feels we have the potential to rebuild it both leaner and stronger.
I think everybody is trying to look at how can we best serve the population. Let's don't just go back and get the money and put everything back in place that we have. Let's use this as an opportunity to really take a look at everything that we're doing in the state and see if we can do it a little bit better. Let's get off the bottom of some of those healthcare lists.
Did the storm clouds of the recent hurricanes have any silver lining? That will become clearer as recovery continues in the weeks and months ahead.
As usual, our audience tonight was selected at random by LSU's Public Policy Research Lab. As to political affiliation, 13% of respondents identified themselves as independent or other. 29% said Republican, and 55% said Democrat. But make no mistake, this is a fairly conservative group. Less than 1 in 5 identified themselves as either somewhat liberal, liberal, or very liberal when it comes to economic issues. 34% say they are economic conservatives, and 39% claim to be moderates in this area. On social issues, conservatives took the lead with nearly 45%. 31% were in the liberal camp, and 21% were moderates. Just over 68% of respondents had at least an associate's degree or higher. 21% had earned a high school diploma or GED. The group, as a whole, gave poor grades to the way Louisiana's healthcare system handled the disaster. Only a quarter of the respondents said the response to medical needs was either good or excellent. Slightly more than 60% thought the response was fair or poor. An amazing 40% of those who took the survey said they knew someone who had sought medical help as the direct result of the hurricanes. A little over a third knew someone who had sought counseling or other mental health services because of the storm-related stress, depression, or other anxiety. When presented with a list of 8 healthcare issues they were most concerned about, nearly 30% of respondents ranked infectious disease as number 1, mental health or stress-related issues ranked second, and third place was physical risks of crime or violence from people displaced by Hurricane Katrina. Let's start there. What are the top healthcare after effects of these storms? Barbara, what do you think? What's number 1?
Perhaps for me, I felt like it was insurance for those that do not have any means of insurance. As a nurse, I see those daily and coming into the hospital that are frustrated and have problems with this. And it's time, as a state, we could meet these needs and begin a new era for our country, actually, in doing that.
And so the state needs to be the first one responsible?
I think the state could start the impetus along with the government and thinking, what can we do? Let's change things just a little.
Melvin, what do you think?
Well, my primary concern would be with healthcare facilities availability. If you look at the destruction in New Orleans, and it says, where will these people go for healthcare? And that, to me, is the biggest problem facing the state. We were already overburdened.
So what happens next? If we can't get insurance and we can't find health care, what do people do?
Well, I've got a couple ideas on that because I've been thinking about it, and my name is John Schultz. I think the model we've had in the past with the big public hospitals and has not worked very effectively. I think it's time now to start with clinics providing basic health care to all people, rich and poor alike. This is the only developed country that does not have universal health care of some type. We don't have even the basic care for some people. You take a person, go to one of these large hospitals, they'll stay there for 20 hours sometimes. If they went to clinics and we took care of some of their basic needs and their drug needs immediately, they wouldn't have to do that. It costs money to save money, and we have to change that model. This is not a good model we're using in Louisiana.
Sally?
It's the worst healthcare system unless you compare it with every other healthcare system in the world. I mean, the results of this healthcare system, are the best in the world, even though they're not perfect. And so we need to be careful about trying to make radical change that's going to, impact that good result.
So I see a couple of you nodding your heads. Radical change? Do we need to change the way we deliver health in Louisiana, or do we need to fix it and get back to normal?
We need to, Yvonne is the name, we need to change the way that we provide health care in the U.S., period. I'm a retired nurse, and I have seen, and it's like John was saying just a while ago, people go into the hospital, they are waiting long periods of time. I mean, for services, if they had a clinic, somewhere they could go, they could be treated out, no time. And another problem is a lot of people don't have insurance, therefore they use the emergency room as this is where I get to see a doctor.
Joan, I saw you.
That's true. The emergency room use emergency rooms are overused as first care physicians for people who do not have a regular physician, and they add to the backup. That's why, waiting 20 hours if you have a sore throat, and you could go to a clinic, an after-hours clinic, and be seen much faster.
So no more charity hospital?
Well, the fact is we're paying for health care already. I mean, we're paying for the people who are uninsured. And so one way or another, if we can become more efficient, I thought exactly the same thing. I'm not a healthcare professional, but why do we build? We're about to put how many millions of dollars into rebuilding a charity hospital in New Orleans, tearing down Earl K. Long in Baton Rouge and doing the same thing. Can't that money be better utilized maybe through clinics, through other kinds of facilities that would be more efficient other than the emergency room option, which is an incredibly expensive option?
Kevin?
Yes, I think we've recently seen over the past few years an upswing in, for lack of a better term, what I heard someone call doc in a box. I know some people may not like that term, but Lakeline Direct, MedAid, some of these after-hour clinics that can provide those same healthcare services for many people who have common treatable symptoms that can go after hours when it's convenient for them after their working hours of their job, that they can go to these places. Maybe we need to expand that idea or that concept into the charity hospital system.
What do you think, Garrett?
I like the idea of the clinics in particular too, and open to all.
But I'd like to see them built 14 feet off the ground, the way they do in the Caribbean and hospitals as well, because they've had a lot of experience with that kind of thing down there. And to avoid the possibility of water coming in where people who can't move, particularly in the hospitals, to older people, because no doubt that caused some tragedies here.
No generators in the basement anymore.
I agree with your clinic aspect, and that's wonderful. We should have more of undirected health care, but that goes back to your employees. You're going to have to make feasible education accessible to all in order to have more clinics, and I'm a nurse as well. Yeah.
Now, earlier Barbara talked about insurance. If we have these community clinics, can people get help if they can't afford medical services?
I talked to somebody from Canada just this morning, okay? They have like a two-tier system there. Everybody has health care, basic health care. Those who want better health care pay for more and have insurance. That may not be the best system. People still wait a long time. But there's something in this country we have that nobody else has. I'm not from this country, I'm from Germany, okay? But in this country, I think we have a technology base. If you have a bunch of clinics and they're all connected with technology, we use the internet for everything. Therefore, wherever you go, you're going to be served. Your records go with you. We don't have that in our heads yet. We're still keeping paper records in many places. We should be disseminating this information to these clinics so we can help our people.
How do Hurricane Katrina and Hurricane Rita evacuees get help if they can't get their records? I mean, what happens to those people?
I've even heard barcoding is going to be the wave of the future, so maybe we could be first in light of we're having to rebuild it now. Maybe we could be the first to barcode everybody so that it does follow them. You know, your records do follow you around. I'm sorry.
I know in dealing with patients that are so frustrated because they hurriedly left New Orleans and then they did not have but just a meager supply of medications. And perhaps that medication was to be terminated or to be refilled at the end of that week. Then how can we need to organize some form of a follow-up where when there is movement on a sudden basis, perhaps because of health issues to another state, that can be followed up and without infringing on the person's privacy, because that is a very important part as well today. And I feel in doing so that we can resolve some of the issues of mental anguish that those that have medical problems and that are frustrated anyway can alleviate.
Thomas, I see you shaking your head. Can we make this better? Could we do this a different way?
I think we can. The problem I think we're going to have is finding the vehicles to go there. Should we continue with our med cards to people that just not able to provide for themselves, so they can access these clinics? I'm listening to everybody, and I think it's great information. The only thing that I'm thinking about is that what if we had another disaster, and where would these people go from New Orleans that had to stay in these nursing homes and lost their life, and these hospitals that had no other place to go? I think we should also look at a possibility of having another facility that could accommodate these people in our state in another event of a disaster. Because after all, how are we going to have a bedridden person? Where are they going to go? You know, as it is now, LSU picked up the triage area, and thank goodness they was there to do it. And I feel like that when we knock down the Earl K, we need to look at plans to perhaps building something larger just to facilitate these type of people, to have extra beds for this particular reason.
Now, I think I understand what you're saying, Bob, but I'm sorry, Thomas, but Bob, who pays? Is it the state that pays for this? Does the federal government pay for this? Do private individuals pay for this?
Well, I like what John led off with, what he was saying. I'm quite familiar with European experiences, Germany in particular also, and there everyone has a national system, and everyone participates, and you can go to get additional care if you want to pay for it. But it works very well, and I don't understand, we have so many arguments here about national health care, and the English system, for example, is brought up all the time. But we should look at the other European systems, and I think they're quite much more efficient and organized than we are.
So you think a national system?
Well, I would go for that myself, but I know that's not a popular view with a lot of people.
Now, Michelle, what do you think?
Oh, I think speaking to what Thomas had said earlier about a larger facility or someplace where these folks are going to go to when, if another disaster strikes, I mean, something else to consider is how are we going to get them there? I mean, transportation out of the city was extremely challenging, and I know that the folks that did that did the best that they could do. It's still, time constraints and trying to get folks out under a stressful situation. Having some kind of plan like that and a place to go.
Now, we've been talking more in the abstract about insurance and about the healthcare system, but what about treatment after Katrina? It looked like a number of you knew people that either needed treatment or you yourself received treatment. What was that experience like? Can we improve that?
Well, I didn't have it in the experience because I lean more with Thomas. We have to get back to zero first. If you talk about Katrina, we can talk about a national system, we can talk about clinics, but we haven't gotten back to zero. We had all these people that were in these hospitals. So what do you do with them? You have to get them back to normal before trying to plan a future kind of system. Of course, you need to do it. But right now, we need to address what was broken and bring it back to zero first.
Was anything broken for any of you? Are there any concerns that you have for your own safety or your own health now that Katrina is behind us and Rita's behind us?
I'm from Baton Rouge. Well, originally from New Orleans, now living in Baton Rouge. And my mother had a health crisis while the evacuation was going on. And so even though, and that impacted her, we were much longer in the emergency room than would have been normal in Baton Rouge. We were much longer waiting for an ambulance because of that. So I think that, the point that we need to maybe, if we do rebuild hospitals that were damaged in Katrina, that maybe we need to build them so that patients can stay there rather than trying to evacuate them into facilities that can't handle not only them, but can't handle them plus the patients that they would normally have. So it's scary for the entire state. And it's a real, important thing for the entire state to invest in making sure that we have safe hospitals in New Orleans next time.
Hi, my name's Catherine, and Baton Rouge is my home. And I agree with Thomas and Melvin. I had some terrifying experience during Katrina and Rita. I'm a personal caregiver of the mental impairment, and I had 7 mental patients with me during the hurricane, and I ended up with 4 displacements, but couldn't take in any more because we were full to the rim. And then the 4 displacements that I got came without any medication. I didn't have any records. Okay, we getting anxious, we getting psychotic, we walking and we pacing. We want to go out the door now. I didn't have any medication for these people, but we made it. And I ended up calling for the Red Cross because I needed some extra help. And they end up telling me that they wasn't the one to call, and I need to call, and I got a whole list of numbers, take, and I was like, looking at my patients, and I'm like, okay, guys, look, this is what we're going to do. We're going to sit on this sofa, and we're going to be quiet. And so I had to end up start thinking of things to do with people that been uprooted from their homes. They know it was a lot of water left behind. They know they was placed on a bus, taken out of a hospital. And then I received the ones that was taken out of the hospital. It wasn't like in assisted living homes or group homes. They came straight from the psych ward. And I'm like, okay.
You bring up a good point, Catherine. I mean, we've got some serious mental health issues that we have to worry about, either people that are displaced and then people that were in the areas that weren't as seriously affected but still have other issues. I'm sure there are people that are worried about their homes in New Orleans. I'm sure there are people here that are worried about traffic or about other issues. Is that something that we need to be concerned with, or do we need to work on physical injuries first?
My concern, for the last 16 years, that's what I do, mental health. That's my love, people. That's what I do. Work with people. And I would say I would agree with Melvin 100. we fix what's broke. The people that sleeping down by Burger King on Florida Boulevard in Baton Rouge and North Foster, they're not from Baton Rouge. The people that sleeping down by the bus station that I've talked to that don't have any medication or don't know how to get their medication or don't know how to pronounce the medication or what, milligrams they take. I received one. He has to have insulin twice a day. He has to have a glucose test twice a day. And, he was almost like comatose when I got him. And not saying at that time, the basic thing was what I explained to them was, I don't know how much they understood, but I had to do some fast talking and sit down, is that we're in a disaster. And the most important thing is right now is we get some shelter, and then once this passes over, then we will get to the solution. Katrina and Rita is gone. Now we need a solution. And the biggest problem is a building that was large enough. There should have been a disaster plan in place from the beginning. If you could come and get my daughter's school bus and tell her to stay at home. We're not going to school today because the lights is out at your school. No generators in that basement. And take all those buses. Those buses should have been ready at Category 2.
Bill.
I agree with Catherine and Melvin, but I think one of the things that we have to watch out for when we talk to our politicians, the people who are going to make these decisions, is if we frame it the way that Melvin said, that we have to get back to zero. The scary thing for me is we simply reconstruct as it was to get to zero. And what you're pointing out, Catherine, is that if we do that, if we build ourselves back to where we were pre-Catherine, your problems aren't changed. Your problems will be there tomorrow and day after tomorrow, forever. And so getting simply to zero makes sense in the abstract, but we need to get to zero in a different direction. Not the way that we, our collapse, we can't simply rebuild. We have to think much more creatively about how to get to zero and to step beyond that. We have the opportunity to do something. You asked about, a national picture, a national profile. I think Louisiana can become a leader overnight.
Of course.
There's billions of dollars out there that we are using either to get back to square zero, ground zero, or to move way beyond that. And, dollar for dollar, we can do so much more if we think creatively.
Exactly.
And we have to think.
Rose, we haven't talked to you yet, Rose.
I agree with the clinics, and just like with the national, with barcode, just like if she needed these patients that would come, if they was set up in a national thing, whatever type of medication it was on, all she would just go to the computer, find out what they're on, what milligram and whatever, so it wouldn't have been as big a problem.
And I agree with Bill 100. But the fact of the matter is, I don't sit on a panel, or I'm not in governmental positions. I'm the little guy doing the, I'm a small part of a larger picture. I pay tax dollars to people who sit around tables and put this kind of
But look what you said.
Puzzle. Yeah,
That's
I understand
so smart,
what you're saying.
because what you said is something that someone may not have thought about.
Exactly.
Right? And they need to hear it from here because they're standing, they're sitting so far above us.
Exactly.
That sometimes they don't know what was going on in the PMAC or in your clinic or in your home.
I've got a question for the people who are going to come after we're done here, and that is, why are we going to build these big hospitals again? Why are we going to spend all this money? We're going to do the same thing we did before. We don't need to train our doctors in these big hospitals. We got other hospitals already available. If the building is just for the doctors, that's wrong.
It was a good idea 75 years ago with Huey
We're the only
Long.
state in
Why
the nation
can't
that
we do
had it,
something new?
but that time's over.
Yeah.
I'd
like to see
we're going to get the experts in a couple of minutes, and so thank you very much for the discussion so far. But when we return, we're going to be joined by a panel of experts to discuss the health after effects of Hurricane Katrina and Rita.
You don't just watch the news, you understand it. You get the full story and the issues behind it. You know the causes, the relevance, the lasting impact. You get honest, intelligent answers to hard questions. You get coverage you can trust. Objective, in-depth reporting by award-winning journalists. You get the stories that no one else is telling. Stories that matter, that challenge you, provoke you, empower you. You get it all from the most honored network in television journalism, PBS.
You're invited to Louisiana Public Square, right in the center of our state's political landscape. It's where everyday citizens gather to share opinions, feelings, and most importantly, questions about the things that really matter in our lives: economic development, education, healthcare, taxes. All the issues that thinking citizens just like you want to know more about. Join us in a conversation where everything's on the table and on the square. Louisiana Public Square. Next month, a By the People special, assessing the nation's health care.
We're discussing the health effects of Hurricanes Katrina and Rita tonight on Public Square. Joining us now is our panel of experts. Donald Smithburg, CEO of LSU Health Sciences Center, Healthcare Services Division, which includes the charity hospitals. Senator Tom Schedler, Republican legislator from the Mandeville area. Senator Schedler has worked in the healthcare industry and serves on the Senate Health and Welfare Committee. Dr. Cheryll Bower-Stephens, Assistant Secretary for the Office of Mental Health within the Louisiana Department of Health and Hospitals. And Dr. Jimmy Guidry, who serves as the State Health Officer for Louisiana. Let's go to our participants for their questions. I think you guys had a lot of questions for our experts tonight. Who wants to start?
LSU. And the charity hospital system, which has been a problem for quite some time. And the facilities in New Orleans were inadequate also. How do you plan to get back to providing enough care for the people who require it there?
Well, that's a great question, and there's no doubt about it. The facilities were, I think some would argue, deplorable. At the same time, interestingly, and perhaps ironically, the quality of the care that came out of those facilities was equal to or better than other institutions, and there's data to show that. But that does not provide any kind of excuse for the facilities conditions. So what are we going to do from here? It's a tough question to answer. Our facilities are down. I think Big Charity is probably down for good as a facility. University Hospital likely is down at least for a long time. And do you want to move back into those facilities, given that they were probably part of the problem? So what we're planning is neighborhood clinics. That has always been part of our plan in New Orleans, in Baton Rouge, and in the other cities around the state where we serve the citizens. But that's not enough. Neighborhood care is absolutely essential. Primary care early and often, hopefully round-the-clock care so that the emergency departments aren't saturated. But you also have to have some sort of hospital infrastructure to support that. A, because there will be needs, and B, because we do train most of the doctors in this state, and doctor training does require hospital experience as well.
Of course. I mean, I don't think we were saying eliminate the hospitals. You can't do major surgery in a walk-in clinic. You know, you can do a one-day, surgery. And you said that, if I heard you correctly, that it has always been the plan to have clinics. I mean, how long has it been a plan?
Well, it has certainly been a plan for the last few years. Resource constraints at the state level have somewhat hemmed us in that regard. But right before Katrina, believe it or not, we had just sealed an arrangement with the city of New Orleans to work with them to manage their 7 community clinics and convert those into larger clinic structure. And, of course, Katrina kind of kicked us in the shins at about the worst possible time. But nevertheless, we want to ramp up to that plan. Now, another key factor is how do you pay for it? And that question was asked earlier. Will FEMA kick in to help us? Maybe, some. But what FEMA will do is to give us, hopefully, enough funds to get us back to August 27th condition. I don't think anybody wants us to go back into those facilities a day before Katrina condition. And so we're hoping to use those dollars to leverage additional dollars so that we can essentially rebuild a more streamlined system, not just in New Orleans, but clearly that's our top priority.
And Senator Schedler, is there anything that the state can do to help that process?
Well, I think we can, and of course, as Donald just indicated, we're certainly awaiting anxiously, as many people are from other sectors, on what the federal government will or will not do in this catastrophe. Our state delegation in Washington has several bills that are proposals up there. Our hospital industry has been to Washington. Donald and LSU have been to Washington asking for various dollars to solve this. I think the magic question is, or the billion-dollar question is when we're going to have forthcoming information on what that's going to be. The difficulty in waiting is that we have a problem on the ground today. Just as many people with their homes that are trying to scramble, do I rebuild my home? Can I rebuild my home because of elevation and the various questions? We have the same problem regarding the delivery system. What I heard here for the moments we had before this were issues about access to care, which ties into Mr. Smithburg's comments, and I agree wholeheartedly that we need to get, and I'll expand that a little bit, to federally qualified health centers. We need to strike while the iron is hot with the federal government that seems to be willing to do some things for us, get approval on X number of clinics, and build those clinics strategically as New Orleans is repopulated in those areas where the population may be. The importance of those federally qualified health centers are that they're primarily built with federal dollars, and it's a lot cheaper for us to run with federal dollars after the fact that don't require limited state dollars. So I am supportive of that. I will say this: I am not convinced yet of the need to build 2 big new hospitals. I need to say that at the onset. I have been a proponent of spreading that to existing hospitals. New Orleans area was overbedded to begin with, and I think it's deplorable to continue to use the argument of education to educate our doctors for the poor. Think about it. We're educating our doctors with the poor. And I think that if we could spread those dollars to other facilities other than to the LSU system, charity hospital system, and to the private sector, that to give people choice, the dollars should follow the patient. And I concede that the educational component is a very integral part of it. It has to be answered. But other states do it vastly different than Louisiana. This is a time for us to look at other options and other models before we venture off into the same thing we had for 50 years.
Bob, any suggestions for models to follow?
No, I don't. This is a topic I don't really know that much about, but I do have a different kind of question, which has not been talked about at all this evening, and that is the sewerage. I've read recently that there's no treatment plants really in operation in New Orleans, and that the sewerage is being dumped directly in the Mississippi River. You have that question. If we had a rainstorm, you're going to have more runoff into Lake Pontchartrain, which will be heavily polluted. And thirdly, kind of a special question: what about what used to be called night soil? In those areas where people are living, where there's no water systems, what do they do with their human waste, and what's the impact of that? Or is it significant?
Dr. Guidry.
It's been a concern of ours as well. When you look at the sewer system in the affected areas where the pipes are broken and you can't get a pressure in there to move the sewage along and take care of the sewage and properly treat it, it is then raw sewage. And right now the EPA has given permission to dump that raw sewage in the Mississippi River. Sounds like a nightmare. And certainly is of concern. It's a temporary fix until they can get the sewer system resolved. When you have raw sewage, that's E. coli and a number of organisms,
and certainly how is that going to affect our water system? Well, it's going to dilute. What we saw in the testing of the water in Lake Pontchartrain at this point, that the E. coli is not any higher, not much higher than what you see after heavy rain. So we can still have time to fix the sewer system and get back to where we're going to go. Now, some people say, well, how does that affect our seafood? You're dumping raw sewage, and we rely on seafood. But for the most part, fish, shrimp, crabs, they move away from this stuff. Right. And we've tested them, and they're still safe to eat, especially you want to cook them. But at the same time, they're really not that contaminated. Oysters, however, are a different type of animal. They stay in a bed, and we're going to lose a fair amount of our oyster population, and we've closed oyster beds to say at this point it's probably not safe to eat those until we can get the water clean and get the oysters growing again. But we will have killed, the storm has killed about half of our oyster population, and that's of great concern.
Bill?
That idea of trying to get better than where we are, when you say that the runoff from Katrina, the sewage, was no worse than an average rainstorm, shouldn't we be concerned about average rainstorms then?
Well, what we've done in Louisiana is test waters around the state, and after a rainstorm, there's a pretty high E. coli. I've had to deal with the issue of the Tangipahoa and whether you can tube in it. And what we put out across the state is swim at your own risk. Because if you're not paying attention to right after a rainstorm, the E. coli count goes up. When we tested to see where it's coming from, it wasn't from so much raw sewage. It came from cow manure. It came from animal waste. It came from waterfowl waste around the state. Add to that if you have human waste that's not being treated properly. So we put in all these rules around the state on how to treat sewer properly. And we get a lot of grief because it costs money. You buy a trailer and you got to put in an individual mechanical plant. It's expensive, but if we don't do that, that's raw sewage from every household going into our streams. Lake Pontchartrain was getting cleaner and cleaner and cleaner because all the things we did for camps and treatment of sewage, and then we had this disaster. So now we have to get back to where we were. I'm not saying that things are great, but they're not as bad as people thought. There's not the toxic soup that people started saying. So we can get back pretty quickly if we start taking care of these things.
Dr. Bower-Stephens, are there any other concerns that we need to worry about?
Yes, from a mental health perspective, I really like the idea of getting to be better than we were before. Louisiana Office of Mental Health had a crisis management plan prior to Katrina and Rita, and we successfully implemented that plan. We successfully evacuated 2 of our largest psychiatric hospitals from the impacted area to the Baton Rouge and Jackson area. And I think that post-Katrina, the incidence of mental health issues will go up. People are going to be dealing with issues related to loss, but it's going to be very important that we give out a message of hope, that we give out a message that people can recover from this, and that we know that there are individuals who will be resilient. But the stress on our mental health system will be great as a result of this hurricane. So we'll have to think about how we're going to do things better and more efficiently than we've done them in the past.
Natasha, what are your concerns?
Well, I wanted to go back to the issue about the health. I do agree with Mr. Schindler about we do need to explore all of our options, not just settle on one option, and we definitely don't need to go back to the way things were. We do need to move forward, but we can't just settle on one option and go that way. We need to look at everything and get everybody's point of view and then move forward from that point.
Senator Schedler, is there? Go ahead, Tom.
Excuse me. I'd just like to say something. I want to go back to the hospitals just for a brief moment. I know we're going to probably need some help, federal dollars, in order to do anything that we're discussing here tonight. And I do believe, I don't know about the Baton Rouge area, but out of New Orleans, you're telling me that there was an overabundance of beds on a routine basis. Well, in the Baton Rouge area, normally, if you had a heavy flu case, along with the bearing childs and surgeries and so forth, there's times where you can't get a hospital bed in Baton Rouge. I mean, I was in a situation where I couldn't get in for 3 or 4 days, and then it was on a priority case. So I do believe we need to kind of step back and make it a point to Washington that it's time for them to get off the fence and decide what programs that they spend in billions of dollars on that's not really helping the people in the United States, and decide to go in and get into the healthcare field and clean it up.
I agree with that, and of course we have a limited time, but just to expand on my comments, it is a national problem. It's not just typical to Louisiana.
Correct.
Louisiana had its atypical system in place, but it is a national problem, and of course things like national insurance or national plan. I've always had the argument that Louisiana in the United States is 75% nationalized anyway. And people look at me a little crazy when I say that, but if you think about it, Medicare, Medicaid, and the uninsured are all paid for by taxpayer dollars. There's only about 25% of private commercial pay, and that is a decreasing number as we speak. So we have a national system right now. It's not very good, and it's very convoluted and segmentized, but if we could collapse that in some way, at least for that segment, and put it into one, it would make some sense. And I do believe we need a good trauma center in New Orleans. We need more than just New Orleans. We need others. We need a good heliport compiled with that. And I'm certainly open to a small hospital connected with that for maybe some of the most severe cases. But just keep in mind, the reason why other hospitals, in the last 5 years, there has been an increase in uncompensated care to the private sector and a decreasing side to the charity side. So the patients have gotten smarter. They're going to other hospitals right now, showing up at the door for emergency and care. And those are statistics that I can support. So I think the issue is reimbursement. The reason you don't see hospitals doing more of it, there has been no reimbursement in place for those patients. We passed a provider tax, which is pretty much in the toilet now because we lost a lot of hospitals that would have been contributing to that. But there are some things I think we can do if we move what we call Medicaid dish dollars and move them and allow other people to participate, especially if you get above some floor amount. I mean, every hospital should do some minimal amount of uncompensated care as part of their just cost and service to the community. But we have some that are doing an inordinate amount, either because they want to or because they're at the doorstep. I think they should be compensated for that. And when we start doing that, we're going to start moving those patients around.
I wonder if I could try a stab at that as well, Thomas, because I'm going to respectfully disagree with my friend Senator Schedler on a couple of points. One, when you look at the cost of care, and I think we would all agree, probably in this nation, that health care is too costly. But when you compare what it costs in the public sector compared to the private sector for the same level of coverage, the public sector in this state is 18% cheaper than in the private sector. And there are a variety of reasons for that. And also, when you look at why patients, indigent patients, are going to private hospitals more and more, it's for two reasons, in my view. One, there are more people without insurance. Many of them work, but they don't have access to health insurance. And number two, the public hospitals have had such constrained resources, budget cuts, if you will, that patients have to find other resources. So as we, in the public side, cut back on beds, doctors, nurses, clinics, patients still need the care, and they've got to find a place to go. And where they end up going is a more costly system. We need to explore options to do things better in the future, and partnerships may be part of the solution. But I don't think we should fool ourselves into thinking that it's more expensive under the current paradigm, because there's proof that it's not.
Do any of you support universal health care coverage?
You know what? Louisiana already has it.
But it's an inefficient way with the uninsured.
How so?
Well, emergency room service rather than preventive health care.
But when you think about the structure, I mean, I don't disagree with you, but when you think about the structure that's in place, it is universal health care. It's not funded properly, and the facilities are deplorable. But the overall structure, and national experts have told us this, real thought leaders in the healthcare industry, they say, we've got in Louisiana the parts and pieces. We just haven't been in a position to fund it properly.
So it won't cost us more.
Well, we are all going to have to eventually reinvest in facilities. Yes. You can't expect anyone to take their loved one to some of these facilities. Even if the care is good, it's not a comfortable place to be.
And I need to weigh in on this from a mental health perspective, because when we talk about universal health care, there's an issue called parity as it relates to people with mental illness and substance abuse, where even if you had baseline health insurance, if you had a mental health issue, if you had a substance abuse issue, your treatment would not be covered. And so I think when we're talking about individuals with mental health and substance abuse, we need to think about parity, and we also need to think about the number of these individuals that are presenting to emergency rooms that has increased as a result of Katrina and Rita that are contributing to this weight that you all are talking about that you experience in the emergency rooms. So we can't forget to talk about parity from both a federal perspective and a state perspective when we talk about universal health care. I just need to get that in. So y'all can.
And Dr. Bowers, you bring up a good point. I mean, we focus on New Orleans, but it sounds like this Katrina and Rita both have effects throughout the state. Are there other areas that we need to worry about? And Yvonne, I know you're also going to add something to that.
I wanted to ask a question concerning, since you're from mental health, what is the state, what are the plans, what are the reorganization, what is going on? Because I have 40-some members of family members that was evacuated. The children, and this is what I experienced, they had a hard time sleeping. They could see water plus bodies. Okay? This aftermath is going to go a long time because most of the people are still in shock. Right. See, reality hasn't set in with a lot of people. Right. And I want to know, what is the state? What are the plans?
Okay. Well, as I stated, the Office of Mental Health successfully implemented our plan for Katrina displaced persons immediately after the Katrina hit. We immediately requested federal support. We received a $200,000 grant from SAMHSA and FEMA to begin to address the issues for people who were directly impacted by Katrina, and as well as first responders, people who responded to Katrina. Because if you can recall, there were 2 police officers that committed suicide in New Orleans Police Department. And our plan is to find a way to increase our capacity, first of all, through receiving these federal dollars. We've also received $10 million from SAMHSA to begin crisis intervention services for people that have been directly impacted and are working on a grant to get additional funds that will take us through 9 months post-Katrina. As it relates to long-term planning, we're working with our 2 universities to begin to integrate within our public mental health system the ability to treat post-traumatic stress disorder, which are some of the symptoms that you're talking about that children are having, to treat anxiety, sleep disorders, and those things that we know will increase after the storm. We're working with CMS at the federal level to look at an uncompensated care strategy, Senator Schedler, that I believe you had discussed prior to this storm, of being able to take our crisis intervention services as well as some of our mental health services, have them connect to an uncompensated hospital, whether it be a private hospital or LSU hospital, so that we can begin to meet the mental health needs. So we have been thinking about it, we have a plan, and we're currently implementing that plan.
So as we speak right now, that plan is not in place as far as these people having somewhere to go and someone to talk to or hotline
as we speak right now, that plan is in place. As we speak,
where is it?
As we speak right now, we have put mental health professionals through federal volunteers in each of our LSU public hospital emergency rooms. We've been working with LSU Health Sciences Center to assist in triage out of these emergency rooms. We do have hotlines that have been set up either by the state or the federal government that people can call if they're in a crisis. So this plan is being implemented.
And Dr. Bowers, we're going to have to end. We're going to have to end with you today. We really want to thank our guests today for helping us through this process. So thank you, Mr. Smithburg, Senator Schedler, Drs. Bower-Stephens, and Guidry for joining us tonight. When we come back, we'll have a few closing comments.
Louisiana, the state we're in. Every week we offer statewide coverage of newsmaking headlines, politics, culture, history, the environment, and more. Join Robin Eckings and Charlie Wynnum for the 29th season of this award-winning news magazine. Louisiana, the state we're in.
Well, Craig, an intelligent group of average citizens.
Absolutely. I mean, I wish we had more hours. I mean, there were really so many questions to ask, and we just didn't get a chance to get all of them today.
Well, I mean, hard questions, and we're going to be looking at answers for many months and years to come.
Right. I mean, there's a lot that we have to discuss and a lot we have to do over the next couple of years.
Well, that's all the time we have for this edition of Louisiana Public Square, and we invite you to take our full online survey about the health effects of Hurricane Katrina and Rita by going to lpb.org.
Next month, a special By the People edition of Louisiana Public Square will feature highlights from this year's LPB Deliberation Day Forum. The topic will be controlling health care costs.
Well, a lot of healthcare issues, but I think they're on the minds of everyone in Louisiana these days.
Absolutely.
We thank you for joining us this evening. Good night.
A home video of this program is available. For more information, call 1-800-973-7246 or write to the address on your screen.
Donate to the Power of Hope Fund for Katrina disaster relief. Join Entergy as we help disaster victims rebuild their lives. Because the power of Katrina is no match for the power of hope.